Hello, my name is Mara Gabrilli, the Brazilian candidate for the United Nations Committee on the Rights of Persons with Disabilities, the CRPD. Over 3 decades of my career, I have accumulated a lot of experience as an activist in defense of the rights of people with disabilities to access and expand health resources, rehabilitation, and assistive technologies, as well as policies for educational and professional inclusion, and to encourage sports, leisure and culture, accessibility, and sustainable urban mobility. In 13 years as a parliamentary in Brazil, I had the opportunity to be the author of the final text of the Brazilian Law of Inclusion for Persons with Disabilities, which is based on the Convention on the Rights of Persons with Disabilities and their optional protocol. From 2019 to 2022, I worked as an expert at the CRPD, and during this period, I improved my expertise mainly through the preparation of General Comment number 8 on the right to decent work and an unpublished guide for deinstitutionalization. As a member of the Working Group on Girls and Women with Disabilities, I defended the inclusion of gender as a structural agenda in all UN collegiate bodies. And I have also proposed actions in relation to situations of risk and humanitarian emergencies. Regarding the challenges to implementing the convention, there are multiple challenges, but discrimination resulting from ignorance and lack of information is perhaps one of the most limiting. Promoting accessibility is another major global challenge, as cities' means of transport and communication were not planned with human diversity. Another challenge is the absence of specific local legislation that guarantees all rights in accordance with the Convention. The Brazilian Law of Inclusion of Persons with Disabilities is a great advance in my country. However, we have not yet achieved its complete implementation. An example of these challenges is that the medical model of disability assessment is still in force in Brazil, even when the law determines the biopsychosocial assessment to be carried out by a multidisciplinary team.